Well, good morning, everyone. Good morning. All right, that's good. Thank you. I'm Victor Dzau. I'm the president of the National Academy of Medicine. I'm a Dookie. I'm sorry to say to some of you, but I'm a North Carolinian. That's the most important one. My wife and I still live in North Carolina. I'm actually a Duke faculty on leave of absence in Washington. So for those of you who may not be familiar with National Academy of Medicine, let me just give you one slide to tell you who we are. Most of you know us as Institute of Medicine. But then I want to tell you about why we're so excited about being here in North Carolina. So, let me see. There you go. So there are three national academies in the United States, certainly in the science area: National Academy of Sciences, National Academy of Engineering, and of course, National Academy of Medicine. Our founding organization is the NAS, or National Academy of Sciences, which was chartered by Abraham Lincoln and Congress in 1863 to be that advisor to the nation. Now, at that time, because it was during the Civil War, it was really critically important to have independent advice from scientists and experts. And because over the 150-some years, we have been the independent advisors. We're not part of the government, but we're authorized, in fact, by Congress and chartered to advise Congress, U.S. administration, and of course now I see the nation as the public and also globally. And you can see that in 1970, because of the importance of health and medicine, the health arm of National Academy of Science called IOM, Institute of Medicine, was founded. We have actually functioned as the third academy for all these years. And so in 2015, a year after I got there, we reconstituted to become the third National Academy officially. So currently we are co-governing the National Academies by the three presidents of the academies. And as you can see, our job, and we're very proud to label this by New York Times as the most esteemed authoritative advisor on issues of health and medicine. And its report can transform medical thinking around the world. Certainly we believe so, and we hope so. And that's why we're here. I want to welcome you to the symposium, Vital Directions for Health and Healthcare, the North Carolina Experience. Before I begin, I'd like to thank NC Biotech Center and CEO Doug Edgerton. Is he here? Doug, thank you very much for hosting us. Greatly appreciated. And of course, to the planning committee, to Mandy Cohen, my co-chair, Dietrich Jess, and of course staff, particularly Jessica Marks, for organizing this event. Okay, sir, first, you know this so well. This nation has faced major challenges in healthcare, areas of increasing demand, unsustainable costs. And we also face issues about access and quality, in addition to affordability. Efforts are being made to transform healthcare, which includes shift to value and address the fundamental drivers of health in order to improve health of the population, the social determinants. So we know there's a lot of progress to be made, particularly in the last 10 years under the Affordable Care Act, and there remains to be lots of challenges, and you all know about this. My own feeling is irrespective of the political winds, we need to continue working towards improving the healthcare system, and that's why we're here. Today's symposium will provide a platform for understanding the status of health and healthcare at the state level within the context of our National Academy of Medicine's Vital Directions initiative. So in 2016, in anticipation of presidential election and entry of a new administration, we at the NAM launched this initiative with a bipartisan group of very distinguished current and previous leadership in healthcare, in government, and also in health altogether. And this initiative convened more than 150 experts of researchers, scientists, policymakers to provide expert guidance in 19 priority areas for U.S. administration. This was co-chaired by myself and Mark McClellan, and the publication that you see a little bit of picture about this created a framework for achieving better health and well-being high-value healthcare and strong science and technology for the nation. So Vital Direction was really instrumental, in my opinion, in informing Congress and presidential election during the 2017 national debate about reform of the ACA, or the repeal of the ACA, if you will, providing a framework that refocused policy conversation with Congress and policymakers on the foundational principles of good health and healthcare in the context of repeal. I can certainly tell you that I went and saw almost all the leadership in the Senate with Bill Frist and with Tom Daschle, depending on which side of the aisle I've met different senators. But nevertheless, I think there was really good conversation to refocus on what we're trying to do in healthcare and why. And certainly you know what the outcome is, and I'm quite pleased to say today we still have, ACA, which I think is certainly sending many of us in the right direction in healthcare. But I think our effort also underscored the importance of state and local actions. So while national policy can have great influence on many issues in care delivery, progress really depends on actions at the state and local level. It takes local leadership to set expectations, implement policy, and bring together different stakeholders and communities. And it takes a community to work collectively together across multiple sectors to address social determinants and improve health outcomes. So this is why we're here, because as an extension of Vital Directions, it's very clear to us that we need to turn our attention to the all-important state level, beginning today with the symposium in North Carolina. So we purposely decided to pivot the state level, begin with North Carolina, because not only because I love the state, but because this is where the action is. It is truly at the forefront of transformation healthcare. North Carolina illustrates the promise, but also those challenges you're all aware of facing U.S. health and healthcare. For example, in North Carolina, we have some of the most amazing premier health systems and healthcare innovators, many of you in this room, capable of delivering state-of-the-art care, as well as healthcare providers and community organizations, again, many of you in this room, implementing new population health innovations. Yet we face pressing challenges, rising population mortality rates, substantial health disparities. 14.7% of North Carolinians live below the poverty line, and too many are uninsured, about a tenth of our population. Rising healthcare costs putting tremendous pressure on state budget, and of course limiting wage increases. Now, despite these challenges, there's a lot of reason to be hopeful despite the recent setback. This article, written by Mark McClellan, who will be here later on, noted in the 2019 Health Affairs article, thanks to a convergence of public and private sector healthcare leadership, North Carolina is now on the verge of something really different. North Carolina is now creating a set of reforms, a hope to create a set of reforms that will create an unprecedented shift to how healthcare is paid for in the state, and how the way social risk factors are incorporated into healthcare payment and delivery reforms. And over the next 5 years, the state is poised to make an estimated 70% or more healthcare payments through alternate payment models. No other state, according to Mark McClellan and others, is on track to reform payments so much and so fast as with the goal of improving population health and healthcare delivery while lowering healthcare spending. And that's a quotation from the paper, and I truly believe in this, and I really think North Carolina has the leadership to make all this happen. We're so pleased that Governor Cooper is here today, of course Secretary Mandy Cohen. They're both working so hard to try to transform Medicaid through a series of efforts of expansion as well as transitional managed care. And despite setbacks, I know they're committed to do so, and we'll be hearing from them. We're also going to hear from Blue Cross Blue Shield, their effort in Blue Premier, an ACO payment model, shifting to population payment linked to outcomes and total cost of care with downside risk. And of course, the business community, Vision 2030 of the Chamber, also developed a roadmap to value-driven care and many others. I know there's a lot of work that remains and still a long way to go implementing this, but I'm really excited to be a North Carolinian and to know the leadership in this state and so many others all believe that the pathway towards, in fact, better care for our population is to change the way we do things, change the payment, and begin to move towards truly a value-based organization and state. So it's an exciting time to be in North Carolina. We wanted to be here to engage in this discussion. I do believe that many of the things that is happening here are models for the rest of the nation, which is why I'm a strong proponent to have our first meeting here. This symposium aims to bring together stakeholders to better understand actions that have been taken, hopefully be undertaken in North Carolina, and offer an opportunity for us to interact and discuss and really work together towards improving the situation here. There's a lot of people I need to thank, but I want to end by thanking Mandy Cohen. She's my co-chair, and her staff has been wonderful. And of course, our planning committee, you see that in your book. You know all of them. They're all here, North Carolinians. And of course, my executive officer, Michael McGinnis, who's here today. And most importantly, to thank Governor Cooper for being here today. We've really honored, Governor Cooper, that you agreed to join us. I know you have a very busy schedule. We know you care a lot about health and healthcare and is working tirelessly to bring high-quality healthcare to North Carolinians, to keep family healthy and ensure equity for all.